So think about it. If you get like 10 patients or 15, 20 patients, they're spending $1,000, which patients spend a lot more than that on supplements. If your patient's spending $1,000 every month on supplements, you're getting $300 just by doing nothing, essentially. That's like just added income. The last thing we want to hold you back is like, but how do I do this? Like, I'm learning this, I'm going into functional medicine. Like, how do I translate my knowledge and skills to a profitable practice that is a sanctuary for patients who want to heal, who want to recover, want to feel better? First thing we're going to do is going to burst the myth that so many practitioners I heard before saying, is that if you want to offer functional medicine, you need to lease an office space, receptionists, you need social media ads. So that's simply not true. And I'm going to say this twice. It's simply not true. And I know that because when I first started, I had to spend a lot of money on like 3 different functional medicine programs. I kept looking for where that clinical application is going to come from. Then I hired a mentor, and I had no money for marketing. And so I didn't have thousands of dollars to give Mark Zuckerberg, the owner of Facebook, to send me more patients. So I learned strategies that don't cost any money. I learned strategies on how to fill up my schedule. So it's possible. And if I did it, you can do it too. If our community members are doing it, you can do it too. You don't need a physical practice if you don't want to have one. You don't need a full-time staff. You don't even need any staff when you're first starting. You don't even have to have insurance contracts. You don't have to have a billing department. You don't have to have prescription infrastructure if you choose to just do functional and integrative medicine. You don't need any expensive medical equipment. You don't need long-term commercial lease or contracts. You don't need any of that stuff. In fact, many of our community members are starting virtually from home, where all you need, the most essential thing, is just a computer and internet. I wanted to give you some tips. Like, here are some tips when you're thinking like, Tal, how do I get started with this thing on a small budget? And I just want to, help as many patients as I can and get rewarded for, developing my skills, investing time, energy, and developing skills into helping those patients. So let's take a look at this picture. There's a few tips here you can see, which is 1, start part-time. So many of our community members just start 1 day a week or 1 afternoon a week. They're starting small. They're just doing cash-based consultations. If you want insurance, we can definitely show you how to do that. But 99% of functional medicine practices are cash-based. As we mentioned, it's a different model than insurance model. You want to spend more time with patient. You want to be able to provide the care, that well-rounded care that the patient need. You can do it virtually. For some practitioners, if you really want that kind of old-fashioned physical location, then what Gina, one of our nurse practitioners, did, still in the oncology department, but she wanted to help patients with autoimmune conditions and patients in their journey to heal from cancer, and they're not getting any answers about their diet, supplements, or lifestyle changes from their oncologist. So she wanted to open that place which they will feel comfortable to come in, share their concerns and challenges, get supportive guidance. So she found a local clinic. They had an available room, and she just rented, it was a very small fee. She just rented the room for 1 day a week. That was very simple. Labs and supplements you can have on demand. So there's multiple vendors like FullScript that you can open up an account. Patients order those supplements. You can even do like sort of a affiliate deal with them, which is patients buy supplements, you get 30% of it. So for every $100 the patients spend, you get $30, and patients still get a preferred discount. They get a discount, they get a preferred rate, and it's shipped to their home. So think about it. If you get like 10 patients or 15, 20 patients, they're spending $1,000, which patients spend a lot more than that on supplements. But let's say you got your patient spending $1,000 every month on supplements, you're getting $300 just by doing nothing, essentially. That's like just added income. Labs, the same thing. You can order all labs virtually. You don't need to stock any lab kits. Those will be shipped to the patient's home. And on the bottom, you can see this is sort of just an example. So even if you're just starting one afternoon, you're only seeing 4 patients because you're just starting. You're only charging $250. You want to make it affordable instead of charging like what other practices are charging, like $450 or $650. Or I've seen a few clinics in the East Coast that charge $900 and $1,200 per appointment. But let's say you want to make it more affordable for your patients, just $250 per visit. It's an hour visit. That'll be $1,000 for that afternoon, and from there you can keep growing that. Of course, we've seen practitioners that make $6,000, $9,000, $12,000 a month just growing that. Right now, on the other side, membership is going to be a little bit different. That's another different type of service or offer. So with a membership model, instead of paying you every time they show up $250, they pay you $313 a month, and then they get to see you every week or every other week, and they don't pay more. So it saves the patients a lot of money. You can also give them maybe additional discount on their supplements. So maybe they get additional 20% discount. This is something you can set up automatically with full script. And so they save money. They save a lot of money, hundreds of dollars. They have you to contact or to do a quick check-in, 30 minutes once a week or once every other week. And they know that they're not paying more than $313 for your services. If you got 30 patients, that's over $9,000 a month just from a simple membership model, or over $112,000 a year. So again, this is like a simplified model, but you can have one, you can have both. We can definitely guide you on that. Of course, as I mentioned, the low-cost marketing is we do have workshops, practice growth workshop, that will actually show you how do I help my patients in my community to find me. If I now open a functional medicine program for type 2 diabetic patients or arthritic patients or women's health patient, maybe that's something I'm passionate about, we will show you how to make yourself known in the community so those patients can find you. And then, of course, the last question we get asked is, who is this for? This is an advanced program. So the Functional Medicine Accelerator is a 4-month program, but as Dr. Esha mentioned, you get from month 5 to 12, we have mentorship. And so we're continuously here. We have ongoing trainings that keep improving your skills, but you're getting certified in about 4 months. So which is really cool. And you get the frameworks. We teach you, we do case studies together during your training, and you get the protocol app, which has all of the treatment protocols for hundreds of adult and pediatric conditions. So whatever shows up tomorrow, you got a patient coming in, they're on your schedule for PCOS, infertility, rheumatoid arthritis, initial stage of dementia, whatever it is, you just type it in the app, and it gives you the treatment protocols, and then you have a framework and a mentor that is there to support you. So just to be clear, the functional medicine programs are advanced. They're only open to the licensed healthcare providers. If you're interested more in the integrative health practitioner, and that training is a 10 weeks training, it's shorter, but it's more for any of you who are really looking for simple, affordable protocols for chronic conditions. You want more of the advanced nutritional strategies. You also get the phone app that's also included. It's evidence-based. There's also lots of evidence-based herbal medicine, which gives you more natural tools to help your patients instead of more prescriptions. And then, as I mentioned, you get the phone app and the Integrative Health Practitioner book, which has all of the protocols. This is, by the way, a program that Dr. Esha teaches, and this is coming up live every Monday. In 10 weeks, you get certified, and there's lots of really cool stuff in that program. There's metabolic dysfunction, weight gain, cardiovascular condition, women's health, geriatric, neurological. So every week, Dr. Esha is going to dive with you into one specific topic. The cool part is that there's also a scholarship that is offered right now. So it's instead of $4,500, it's only $2,400 with the $2,100 scholarship. So if you're interested, we'll post the link here and you can check this out. This is one of my favorite programs